Thank you for being with us. I'm Dr. Erica Spatz. I'm a deputy editor of JACC, and I'm here today with Dr. Rishi Wadhera, who is an associate editor on JACC as well. Dr. Wadhera is a cardiologist at Beth Israel Deaconess Medical Center and an associate professor of medicine at Harvard Medical School. He's the associate director of the Smith Center for Outcomes Research at Beth Israel Deaconess. And today we're going to be discussing his article, his paper, which will be presented at AHA 2024, first authored by Dr. Lucas Marinacci, titled Rural-Urban Differences in Cardiovascular Mortality in the United States, 2010 through 2022. Welcome, Rishi. Thank you so much for being with us today.
Thanks so much for having me, Erica.
Great. So tell us a little bit about what motivated this study on rural-urban differences in cardiovascular disease-related mortality.
Yeah, so this study was, as you pointed out, led by a fantastic cardiology fellow, Dr. Lucas Marinacci, and it really was born out of our discussions about the state of rural cardiovascular health in rural America. We know that adults living in rural areas of the United States experience higher cardiovascular mortality rates than those living in urban areas due to a higher burden of traditional risk factors and significant social, economic, and health systems challenges. But what we don't know is whether rural urban disparities in cardiovascular health have changed more recently, especially in the context of the COVID-19 pandemic. The pandemic, as all of us know, created enormous disruptions in healthcare, unemployment, and deepening financial strain that disproportionately affected rural America. And so those changes may have exacerbated rural-urban disparities in cardiovascular death rates. And so really the crux of the study was to evaluate how rural-urban differences in cardiovascular mortality changed between 2010 and 2022.
Great. You know, when I was reading your paper, I was thinking about, gosh, we know a lot about these rural disparities. And I was thinking about a lot of the CDC data that's showing us, you know, the top 3 causes of mortality are heart disease, cancer, and unintentional injuries. And I went back and I was looking and I was seeing like, gosh, there's like significant disparities. But you know, reading your paper really also opened my eyes to the importance of looking at trends by age group and maybe potentially other demographic features that tell a more nuanced story about what's happening in rural communities over the last decade. Can you share a little bit more about, you know, your approach to this data and what was the rationale for looking at age differences and what did you find?
Yeah, so we used national death data from the CDC and really looked at how cardiovascular death rates changed overall and across key subgroups, like you just pointed out, between 2010 and 2022. And what we found was that cardiovascular death rates increased in rural areas over this period while declining in urban areas. And so as a result, rural-urban disparities widened. But what was really interesting, and I think what you're highlighting is a really important point, these patterns were largely driven by a near 20% relative rise in cardiovascular deaths amongst younger rural adults, so adults aged 25 to 64 years. And we also, you know, we looked at changes in this overall period between 2010 and 2022 and saw this concerning change amongst younger rural adults, but we also evaluated how the onset of the pandemic in 2020 impacted cardiovascular mortality in these areas. And what we found was that, at least before the pandemic, from 2010 to 2019, death rates were actually declining in both rural and urban areas overall, with the exception of younger rural adults. After the onset of the pandemic in 2020, cardiovascular death rates reversed and began increasing overall in rural areas, with a similar but sort of less pronounced reversal occurring in urban areas. And so when you looked at 2022 and, you know, looked at this sort of contemporary snapshot at the state of cardiovascular health in rural America, what we found was that age-adjusted death rates in rural areas were 1.5 times higher when compared to urban areas of the United States. And so I think a key question, which again you raised, is what's driving, you know, this rise in cardiovascular mortality amongst younger rural adults? They're really the subpopulation that's driving these overall trends. And I think there are probably a few factors. First, we know that cardiometabolic risk factors like hypertension, diabetes, and obesity have been rising in younger adults in the US over the past decade and a half. And those younger adults that live in rural areas have been disproportionately affected. I think second, we know that younger rural adults have been disproportionately affected by quote, diseases of despair, including substance use, depression, and suicidality, all of which confer a higher risk of poor cardiovascular outcomes. And then I think the third thing is that the rise in cardiometabolic risk factors and diseases of despair aren't happening in a vacuum. They have occurred in rural adults and have been driven by worse socioeconomic conditions, including poverty, unemployment, and health system barriers.
Yeah, it's pretty amazing because you see that the stressors of the environment, the psychosocial stressors, the stressors related to socioeconomic status, employment, poverty, and really kind of bend the system. So the tolerance for any kind of stressor, including COVID, is really low. And I'm wondering, like, if we take an area that's already distressed and then topple on like another insult like COVID, a COVID pandemic. I mean, you really see how fragile these numbers are. Like you were saying, there's the chronic stressors in the young adult population. In the older adult population, we're actually making strides. And then COVID comes in and the rates start to increase. I mean, it's really a very you know provoking story for what our safety net is within our within the U.S. and where the disparities are within our safety net.
Yeah, I totally agree. It's you take parts of the country that don't have as strong of a safety net, don't have as much access, readily available access to healthcare, face already worsening socioeconomic conditions before the pandemic, and then you have this huge exogenous shock that disproportionately takes a toll on rural America. And so I think some of the findings of our study are evidence that that shock really disproportionately hit rural Americans.
I'm thinking about like where are we going, as we look at our healthcare system, as we look at health related factors in the community that are contributing to obesity, contributing to loneliness, stress. I mean, I'm thinking about the future and I want to think about, what are the threats to our rural population going forward? And also, like, what are the opportunities? Like, what's exciting, and what could we be focusing on that you think might change the course of these trends, so that a decade from now we see this, and hopefully we see the disparities narrowing, and both rural and urban areas succeeding in the same ways.
Yeah, no, I think those are great questions. So, what are the underlying drivers and what is the path forward? Um, I think we know that rural parts of the country face significant health system challenges, including a dwindling supply of primary care providers. We've also seen the acceleration of rural hospital closures, and those things together have impeded access to both preventative care and acute care services. But I do think that access is only part of the problem. We know that many rural Americans face significant socioeconomic challenges like poverty, lower levels of educational attainment, food insecurity, housing instability, and all of these things are inextricably tied to cardiovascular health. So it's hard to imagine how we're going to make gains in improving cardiovascular outcomes for the nearly 60 million people that live in rural parts of the country moving forward without addressing the underlying socioeconomic conditions that drive these poor outcomes. So getting to your sort of looking forward part of the question, I really do think that improving health outcomes in rural America has to become an even bigger policy priority, both overall and for the incoming administration. rural Americans face sort of these compounding challenges: worsening access to care due to hospital closures, worsening socioeconomic conditions, a growing burden of cardiometabolic risk factors like diabetes and obesity. And the pandemic basically magnified all of these challenges. And so I do think there are a few opportunities to help start to make progress in narrowing disparities. Telehealth is one that we've talked about a lot, and it has been in vogue. And I really do think this is a really important way to bridge the gap in access to care for rural adults. But you know this better than I. Uptake has paradoxically been slower in rural areas compared with urban areas, and so I do think we need to start pulling stronger policy levers to encourage, to not only address the telehealth gap, but also to encourage primary care providers and specialists to practice in rural areas. But I also think we need to look beyond addressing barriers in access and health system challenges. And we need to start thinking creatively about strategies to address the high burden of social risk factors in rural areas. I think that closing the rural-urban divide in cardiovascular health will require an investment in an expansion of interventions that address these underlying social determinants, including potentially social welfare and safety net policies, economic development initiatives, and educational equity programs. And I think those steps, they're bigger steps to take, but I think will be imperative if we're serious about improving cardiovascular health for, again, the nearly 60 million adults that live in rural America.
Yeah, I love what you're saying. I mean, I think what I'm hearing is that we can't be delivering healthcare in silos of, within brick and mortar institutions that aren't connected to the community, that aren't connected to our education and social systems. And potentially using digital health to facilitate those connections is another way. But I think if we go at it alone, just from a healthcare, medical approach, we may not be able to really see the large scale improvements that we need at a societal level that are going to require much more integrative approaches that really reach into communities and consider poverty and education and health all in one.
Yeah, totally agree. I think well integrated, interdisciplinary, and creative approaches are what we need to look forward to over the next decade, incorporating sort of all of the things you just laid out. That if we're really serious again about moving the needle on cardiovascular health in rural America and health outcomes more broadly in rural America.
Well, thank you for your work, Rishi, with both this study as well as your career, which has been dedicated to surfacing health disparities and thinking about policies and their effectiveness. You're a real thought leader and driving science and policy in this area. And we're in a lot of gratitude for you to continue this work, to publish in JACC. And it's great being with you today to hear more about the study.
Yeah, thanks so much for having me, Erica, and thank you to JACC for publishing this study.
Thank you.